Lots of mistakes can be made when you're enrolling into Medicare, especially for the first time, because you haven't done this before and you don't know everything you don't know, and things can absolutely be confusing. They've set it up in a way that it makes it more complicated than it needs to be. I'm going to go through some of the mistakes right now so that you don't get caught in the same situation. I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I'm licensed in all 50 states, so I can absolutely help you. If you're going to stay with original Medicare with a supplement plan, that's what we do. We find the best supplement plan in your zip code at the best cost, and we do the enrollment. So we make it very easy. We put all your pieces in the right places. And one thing I can promise you is if you get it set up through us, you won't have any problems down the road. And that's exactly what I would look for with my healthcare. I want it to work the way it's supposed to work. Let's talk about the mistakes that happen. First mistake is enrolling in Medicare Part B if you're going to continue to work. So that's a big mistake, and you don't want to do that. If you're going to continue to work, and there's a little bit of a caveat here, if your employer has more than 20 employees, so you have to be at an employer, it's actually 20 or more. And how you're supposed to know that, if your employer has 18 or 21, it's a complicated situation. But if they have 20 or more, and you're going to stay on your group health insurance, you do not want to start your Medicare Part B because your group insurance is going to continue to be your group insurance. A couple of reasons you don't want to start your Part B. Number one, there's a cost to it. Right now it's $185 a month, and it would be paying for that without having any use for it. So you don't want to do that. Number two, it's a trigger later on when you do retire at 67 or 77 or 87, then it's going to be like you're starting Medicare at age 65, and you can have an open window to all the choices that you're going to want to have. So do not start Medicare Part B if you're going to stay at your employer with 20 or more employees on their group health insurance. It's just going to work that way through your employer, just like it has all your life. And then when you retire is when you will start Medicare Part B. Another mistake is missing your initial enrollment period. So there are very specific timelines for coming into Medicare, and one of them, the initial enrollment period, the IEP, is the one where you're going to come in at age 65. So if you're not working, not staying on your employer plan, you're going to come into Medicare at age 65. And there's a very specific window. It's a 7-month window, 3 months before the month of your 65th birthday, up to 3 months after your 65th birthday. But you want to do it ahead of your 65th birthday. So a couple of months before you're going to turn 65, and then your Medicare will start on the first of the month that you turn 65. Unless you're born on the first of the month. If you're born on the first of the month, it's going to start on the first of the previous month. So again, you want to do it early, and you want to get your stuff set up, your A, your B. If you're going to stay with original Medicare supplement, maybe a drug plan. But we walk through all that with you. We make sure we hit all those timelines, put all your pieces in the right places. Just make sure we do it early, and then that way we don't have the stress going forward. If you miss that period, it can be problematic. There can be penalties and delays, and just makes it much harder to do. So let's make sure we get our timeline correct, especially if we're coming in at age 65. Pretty easy. We know we're going to turn 65. Start it a couple of months ahead of time. Another mistake, if you're going to stay with original Medicare, is not enrolling in a Medicare supplement plan within the first 6 months. So once you start your Medicare Part B, you have a 6-month window without any medical questions to choose any Medicare supplement plan that you want. They can't say no. You pick what you want, and that's what we do. We find the right one at the right price, and that's the one we want. We don't want them to have a decision on whether they're going to let us have it. So we do it in the first 6 months that you start your Medicare Part B, and it's guaranteed issue. You choose what you want, and they cannot say no. If you wait until after that, then you're into medical underwriting. So you have to answer a bunch of medical questions. They can say no if you have medical issues that they don't want. So to make things easy, we want to do it really at the same time we're doing our Part B. So when we're doing a couple months before, when we're starting our Medicare Part B, set the supplement up at the same time, and they will start the same day that your Medicare Part A and Part B starts, and then everything's in one little package, makes it easy. Go to the doctor, go to the hospital, no issues, just works like it's supposed to work. Big mistake here. This is a big one, and people get hit by surprise on this all the time. It's called IRMAA, and it's IRMAA, Income Related Monthly Adjustment Amount. What a ridiculous thing to call something. What it means is that your Medicare Part B premium, your Medicare Part D premium is a baseline. It's right now, the B is $185, and that's the lowest. It can go all the way up to more than $600 a month based on your income. So it is all income related Medicare premiums, regardless of whether you're going into a Medicare Advantage plan or staying on original Medicare. IRMAA is always there, and IRMAA is crazy complicated to understand. Number one, they work it off your tax returns, and the only tax returns they can see is from 2 years ago. So if you're coming into Medicare at age 65, they're going to be looking at your age 63 tax returns. And if you made above X amount, it goes up incrementally from 185 to the 200s, 300s, 500s, and again, over 600. I have videos specifically on IRMAA. Make sure you take a look. I've even got a cheat sheet you can download that shows tax brackets and IRMAA brackets. And IRMAA is different than tax brackets, where tax brackets, if you make a little bit over into the next tax bracket, you're only paying tax on that little amount that you went over. With IRMAA, if you make a little bit more, if you made $2 over the next limit, bam, you're in that premium right then. So it can jump up pretty quickly. And again, this catches people off guard more than you could believe, because again, we're looking 2 years ago. Nobody's remembering what happened 2 years ago. And then when you're in Medicare, if you sell a property or take a big withdrawal out of your retirement account or anything that counts as income, it's going to affect this IRMAA, and it can really sideswipe your retirement plan. So make sure you get a clear understanding of that. Again, look for my videos on IRMAA, the cheat sheet. Just make sure that we understand where we are. So when we're making decisions down the road, we're thinking about that income number, because it can jack you up into a significantly higher premium. And if it's you and a spouse, it's double that. So that's 600 plus, double. Now you're 1,200 and change for your Medicare Part B premium. Just a significant difference in how things will function. So those are some of the mistakes that we see all the time. And again, we're here to eliminate as many of them as we possibly can, but you have to call us. You have to visit my website, MedicareOnVideo.com. We'll walk through, we'll make sure that we understand everything that we need to understand so we don't have surprises down the road. Hope you found this helpful. Have a fantastic day.